No.
Alright, so this is my shoulder HOPS test. Let's go. Okay, starting with history. Mom, is there any prior injuries you've had with your shoulders?
No.
No, you've had no pain in the area?
No.
So no sharpness, no sharp pains, no numbness, no burning sensations?
No.
Okay. So I'm going to be moving on. I'm going to ask you that you stand up now. So now I'm going to do the observation part of the HOPS test. So first I'm going to check for some swelling in the shoulders. Okay. I don't see any swelling. I'm going to check for deformities now. No obvious deformities. And I do not see any discoloration. So that finishes the observation part of the HOPS test. Now I'll be beginning the palpations part of the HOPS test. And first I'll be palpating the scapula. So the scapula, her scapula is right here. It's right here. Her other scapula is right here. So, and then I'll be finding her superior angle. So, move her out. Okay, her superior angle is right here. Alright. Wait, no. I lied. Maybe? I'm trying to find. Wait, it's a little. Right here, it's right here. Her superior angle is right here. Alright, and I'll move on to her other side. Alright, this is her superior side for her right side. Now I'll be moving on. I'll find her inferior angle of her scapula. Okay, I found her inferior angle of her left scapula. I'll be moving on to the other side. Okay, now I found the inferior angle of her right side. Next, I'll be checking for her medial border. The medial border of her left scapula is right here. And then the medial border of her right scapula is right here. Okay. Now I'll be checking for her spine of her scapula. So, spine of her left scapula is right here. And then the spine of her right scapula is right here. Next, I'll be finding her acromion process, so I'll follow the spine of her left one. So about here is her acromion process on her left side, and then I'll follow her right spine. And that's her acromion process on her right side. Next, I'll find her coracoid process on her left side. Sorry, getting mixed up. So her coracoid process is right here on her left side. Mm-hmm. And then I'll be finding her coracoid process on her right side. This is her coracoid process on her right side. Then I'll be finding her AC joint. So find where the acromioclavicular was, or the acromion was. Okay. This appears to be where her acromioclavicular is on her right side. Next, I'll find it on her left side. Okay. Her acromioclavicular appears to be around here on her left side of her shoulder. Next, I'll be doing her clavicle. Her clavicle is just right here. Just right here. And then her clavicle on the other side. Okay, next I'll be finding her muscles and tendons. So first I'll begin with her deltoids on her left side. So we got her anterior deltoid, her middle deltoid, and then posterior deltoid. And then moving on the other side, we got her anterior deltoid, her middle deltoid, and then posterior deltoid. Moving on, her biceps. So find biceps long head. We gotta find. I'm trying to find it. It's around here. I'm trying to find it. Like, trying to find where they're. Okay, I found it. Okay, I think I found it. It's right here. I'm trying to find her. Yeah, it's right here. This is where her biceps long head is, and then where her other biceps long head. Okay, I found her other biceps long head right here. I'm trying to find her greater and lesser tubercles. I think this is about where it is. Then to find her short head of her biceps, I'll just find her coracoid process because that's where it attaches to. So her short head of the biceps connects here, and then the other short head of the biceps will connect to the coracoid process right here. Then moving on, I'll find her triceps. So you have her triceps here, and then her triceps on the other side. Then I'll find her supraspinatus, whose supraspinatus will be on the spine of her scapula. So her right supraspinatus is right here, and then her left supraspinatus is right here. Then to find her infraspinatus is right below the spine, so right here, and then her other infraspinatus is right here. Then to find her rotator cuff tendon, or no, teres minor. So teres minor is a bit below the infraspinatus, so go a little bit below. And then to find the other infraspinatus, or the teres minor, we go below the other infraspinatus. Okay, and then to find her rotator cuff tendon, her rotator cuff is obviously covered by the deltoids, but her rotator cuff tendon attaches to her greater and lesser tubercle. So if I could find that, yeah, greater and lesser tubercles right here. And on the other side, they'll attach to here on this greater or lesser tubercles. Okay. And then to find her teres major is right below her teres minor. So to rotate it back, go down. They're a little bit below. They're like right on the inferior angle a little bit. Okay. Then to find her trapezius are right here. You have her trapezius upper right here. Got your middle and then lower trapezius. And then you have her rhomboids. Her rhomboids are a bit covered by her trapezius, but they're right below here, and they kind of connect near the spine. And then to find her pec major is right here, and her other pec major is right here. Her pec minor is right below her pec major, and it connects to the coracoid process, and the other coracoid process connects there. Then we'll move on to our special test. So we're going to do some active range of motion. So first, I'm going to ask you on your own to abduct, which is basically bring your arms out to your sides like this. Any pain, discomfort?
No.
Okay. Next, I'm going to ask you to adduct. So wait, keep your arms out this way. Now adduct, bring your arms back to your side. Any pain doing that?
No.
Okay. Now I'll ask you to do flexion. You should basically just bring your arms out in front of you. Any pain, bring your arms front?
No.
Okay, now I'll ask you to do the opposite, which is extension. So bring your arms back. Any pain?
No.
Okay. And next, I'm going to ask you kind of bring your arms to your side like a penguin. And then internally rotate, which basically means to bring your arms inside. Bring your arms inside. Any pain doing that?
No.
Next, I want you to do the opposite and kind of bring your arms out. Any pain doing that?
No.
Okay. Next, we're going to do some scapular elevation, which is basically just bring your arms up. Bring your arms up. Any pain doing that?
No.
Bring your arms down. Any pain coming down?
No.
Okay. Then scapular projection. So just bring your arms to your front. Kind of try and bring your shoulders together. Any pain doing that?
No.
Alright. Now I'm going to ask you to recheck. Any pain bringing your arms backwards?
No.
Okay. Now we're going to do some resistance range of motion, which we're basically going to repeat all of our previous activities, except I'm going to be pushing back against you. So I want you to bring your arms back out, but I'll be pushing out against you. Okay, good. Alright, now I want you to try keep your arms up to a T, try to bring your arms back inside. Okay. Next, I'm going to ask you to bring your arms back to flexion, so basically bring this, and I'll be resisting. Okay. My arm turn around. Let's turn around. All right. Try to push your arms backwards. I'll be pushing back against. Okay. Equal strength. And then I'm gonna ask you to do some internal rotation so you can turn back around. So I want you to try and bring your arms back inside. I'll be try bringing them out. Okay. Now we're gonna do the opposite. I'm gonna try and push your arms in. I want you to resist. Resist. Okay, good. Next, I want to do some scapular elevation, which I want to bring your arms like this. I'll try to stop them. Okay. Then I want you to bring your arms kind of down. So keep your arms like that and try to bring them down. Okay. Next, I want you to try to bring your arms like this. I'll be trying to resist. Just ignore that. Next, I want you to try to turn around again. Try to bring your arms back. I'll be resisting. And okay, that'll be it. All right, now we're going to be moving on to the very last part, which is special test. And the first test we'll be going on which is apprehension or relocation test. So for this, I'll ask you to lay down on the couch, completely down. I'm going to ask you to bring your arm to like this. Just keep it like that. Any pain, bring your arm like that. Okay. Okay. I'm going to try the other side now. Okay. Alright. You can stand up now. Alright, so now I'm going to perform the sulcus test, where I'm going to try and pull her arm down and see if there's like a little depression that happens when I... Okay. Next on this side. Pull her arm down. Little depression there. Okay, and then we're going to do impingement test. And for this one, I chose nearest. So I'm going to ask you to try to bring your arms like this, and then bring them up like this. Any pain when you do that?
That one does feel a little weird here in the joint.
Do you feel like any clicking, popping?
No, it just feels like a little
Pain? A little pain?
uncomfortable.
Uncomfortable? Okay. Might be impinging on something there. And then we're going to do something called an empty can test. Well, actually, I lied. Sorry. We're gonna do like the 30-degree thumbs down, and thumbs up. So I'm gonna ask you to bring your arms out to the side like this. Turn your arms like this. Bring them like this. Next, I'm gonna be trying to push your arms down. Resist. Try to push them back up. Okay, good. All right. For our very, very last test, we'll be doing the O'Brien test. So I'm going to ask you to bring your arms across your chest like this. And I want you to keep your arm up while I push down. Okay, good. That it ends our HOPS test.